where do you start from as far as this matter is concerned, even though we are very limited time?
Okay, so probably let's zoom in into the findings, the conclusions. As for the narratives, we've all heard so much about them. I want to group the findings into two. The first is what you spoke about. So that will, if you look at the 4 key findings, I'll put number 1, number 3, and 4 together. Number 2 borders on the patient for now, or the victim. Now, if you look at number 1, it's basically telling us that there was no delay in attending to the patient. However, the systemic problems within the facility, which are outlined in 3 and 4, was basically the cause of a delay in getting a definitive diagnosis and treatment. And of course, this tells us that the actions of this gentleman, Ralph St. Williams or whatever his name is, I'm not too familiar with the name, were unfounded because the committee has established clearly that there was no delay. And if you listen to the narratives as evolved over time, the nurses or the medical team were clear in their minds that they had already treated him, and the other patient that he was complaining about had also been treated. But of course, the systemic problems were what they were trying to deal with. And those ones are beyond the scope of the ordinary worker in the emergency room. Now, if you go to 3 and 4, where they talk about the lack of facilities or the broken down equipment and what have you, that begins to tell you the kind of challenges we have in our healthcare system. You know, Ridge Hospital is part of the Ghana Health Service, and arguably, it is their flagship health facility, arguably. So, if here in Accra, we see all these problems, you can imagine what happens in the regions and the districts. And then, of course, the sub-districts. We have situations where virtually all the diagnostic bits, as outlined in the reports, are all broken down. And the recommendation even goes on to tell us that beyond Ridge, there are other problems that we need to attend to in the overall chain. So, i.e., outside of the Greater Accra Hospital, which we popularly call the Ridge Hospital. Now, if the patients or the population do not really understand the dynamics of the health system, we'll have a situation where these inadequacies will always be visited as sins on the workers who happen to be there through no fault of theirs. They are trying to practice their lawfully chosen professions and to help all of us, because health is a common good for everybody. Unfortunately, these problems, I don't know what exactly our problems are as a country and why we get ourselves into some of these situations. The culture of maintenance, the culture of sticking to agreements between parties, because these diagnostic sets that are all not working, they are very more or less recent agreements on some of these things. So you ask yourself, how on earth is it possible for us not to ensure that the details of agreements we have with providers of some of these equipment are just, adhered to? How is it the case that we always want all our equipment to fall flat without any value for all of us? And then we continue to lose lives, we continue to have issues like we are all grappling with.
In 2023, is it June or July, as Dr. Kwame Sapong-Asiedu and Sechi Brown Reginald have brought to our attention, there was a hospital's assessment report that was generated. And among the key findings were that only 38% of all facilities offering inpatient services have dedicated isolation beds. 74% of regional hospitals, 68% of district hospitals, and 36% of other general hospitals offering inpatient services had dedicated isolation beds. Overall, 32% of facilities have access to an emergency transport system for patients. The primary level had the least access to emergency transport systems. 18% of CHIPs and 29% of health centers, 39% of polyclinics, and 40% of clinics and maternity homes. It gives you a litany of how retooling of the hospitals doesn't appear to be our priority. So the very basic things they need, they are not there. And here we were building 11 hospitals, and now we hear also the NDC talking about building some others. Meanwhile, those that are already in existence, they don't have the facilities.
That's the problem with that. The culture of maintenance is so bad, and it cuts across everything. Look, you check all the sectors that we have as a group of people, as a country, and you realize that any facility that is put up virtually lacks maintenance. And it's something that we need to work hard and move away from. You see, on this emergency bits, this is one crucial area where we've actually lost sight of same over a long period. I remember when I was active in, GMA activities, we've had times that we've dedicated a whole annual general conference or a public lecture to speak about things like emergency medicine. Emergency medicine is such that if you don't up your game, you're going to lose a lot of your citizens. Most health facilities don't have what you can describe as a functional or a proper emergency room. Human resource is also another challenge. If you look at this report, it tells you the staffing norms, where on the nurses front, you have a chunk of them having left posts ostensibly to seek greener pastures elsewhere. And I don't fault them at all. Let's be candid with ourselves. We don't manage the human resource properly. We don't treat them well. We don't pay them well. And when others dangle carrots before them, they will go. If you look at what the report said about the staffing norm and the numbers of doctors and nurses who are at post as opposed to what should have been at post just about a year ago, you realize that they've lost a huge number of healthcare professionals. Meanwhile, the population also keeps getting bigger. So the limited numbers who are available now are overstretched, and people like this Ralph Saint, whatever, Williams or what it is, wouldn't understand the nitty-gritties of some of these problems. And we want to go there and assault people and behave anyhow towards health professionals.
What would be your quick comment before I move to Sule and to Rashid Tanko? What would be your quick comment about what the report said, that only verbal altercation confirmed on video, no evidence of physical assault, but the nurse, Miss Rejoice Bote, reported hand injury the next day. She was treated with pain relief, rest, and psychological support. No fractures and no dislocations.
Well, you see, they are conflicting accounts. Let's be honest with ourselves. This lady was on duty. So your duty runs throughout the night till the next morning. I don't know what point in time that this assessment was done. But clearly, from the day of the incident, the lady stayed in the hospital on admission. So I think last Wednesday, Thursday, that she went home, barely 2 days back. Obviously, having been in the hospital for that long, I also don't know the point at which this committee did these findings. But as the standard is, you come in, some initial assessments are done, reviews are done, investigations, imaging, all of it. So I don't know whether the committee had access to all the imaging and the subsequent reviews.
You have doubt about these findings.
What I'm saying is that the narrative, this lady stayed there for about 9 to 10 days. Under standard clinical practice, if somebody is on admission for about 9 to 10 days, obviously there is something wrong. Unless whatever she was on admission for is completely different from, in quote, the incident that happened. But from what we have come to understand, she's been there as a result of what happened. So the natural thing or the logical thing is that if somebody has gone through this and has been at the hospital for even more than 2 days, clearly there is something wrong. Because usually, when somebody comes in, whether injuries, assault, or whatever, we look at it and we may discharge you or we may keep you in.
So I get you. You wouldn't directly answer me and say
no.
You
What I'm saying
doubts
is that
about this report.
Hold
but
on.
That's what you have done. You have impugned the report.
No, what I'm saying is that I don't know the point at which these panel members met the patient, but clearly she hasn't been well and she's been around. And aside the initial bits that we all saw as a medical report, subsequent activities have been done. If you go through the medical records, I'm sure you will see all of them.
You have done that?
No. What I'm saying is that once you are on admission for this, every day we'll review you twice the minimum. Okay. Beyond that, let's also make this distinction. Just a quick one. Let's also make this distinction clear. You know, the criminal investigations being handled by the CID should not be equated to this committee's work.
Of course.
And the police have actually sent somebody to court with some level of evidence. So clearly there could be more to it than is contained in this report.
Well, Samson, I've taken a look at the report, and I think for me, two things. It appears that the report seemed to place a lot of emphasis on the degree of injury or the level of assault or whether the person was wounded or otherwise. And I think that, for me, is not the point. If, for example, she was slapped and you do an x-ray and there is nothing that has happened to the jawbone and so on and so forth, would you say, oh, that was something trivial, or we checked and it didn't have any impact on her or something like that?
In fact, in law, assault is not only when there has been actual battery harm, like beating of the person.
And exactly that is why the lady is actually in court. The thought aspect of the assault.
Yes.